Trish, you're a midwife and you've been involved in helping roll out the female genital mutilation information sharing system. Can you explain how it works and how important it is?
So this system is a means of highlighting young girls who've been born to mothers who've had FGM. We put the indicator on the system and it will act as a prompt when these young girls come to see healthcare professionals. It will just make them be aware that this little girl has been born to a mother who's had FGM, that she is perceived at risk of maybe having FGM, and that they need to keep safeguarding issues in mind when they're treating this child.
And you've also, Jay, seen the actual system and the screens, as it were. When do you feel it's appropriate to ask questions?
From the time a child is born, literally, at different times during that child's journey, they should be asked. And also, if the health professional knows where that person comes from in the world as well, because there are many, many practicing communities in different countries around the world.
But Trish, do you think it's appropriate though for busy professionals to be asking questions, say if the child comes in for tonsillitis?
What we're not expecting healthcare professionals to do is to discuss FGM at every consultation. The hope is that they would look at the symptoms that the child has presented with and then discuss what is appropriate. So if a child came in with tonsillitis, then we wouldn't perceive it would be appropriate to discuss FGM. But if a child was being seen with recurrent urinary tract infections, then yes, that certainly would be an appropriate conversation to have. We expect them to use their initiative and to just use it as a prompt to protect this child when she comes for any sort of treatment.
Now, some healthcare professionals may find it difficult asking questions about FGM. What would you say about that, Jay?
Unfortunately, anything to do with asking questions around any form of sexual violence against a young child is going to be difficult, but if we don't ask the questions, then how can we prevent? We just need to get the conversation started. I think any system that's going to be there to help prevent, because once a young girl undergoes FGMC, you can't take that back. You can't take back the pain, you can't take back the procedure itself. So I think if it helps, then I'm all for it.
I think providing the questions are asked the right way, with sensitivity and politeness, then it will be welcomed. It's an opportunity to have a conversation about this. And at the end of the day, as healthcare professionals, all of us have a responsibility to try and prevent and protect and safeguard these young girls from having FGF done to them.
So why is a family history of FGM so important in actually generating this indicator to be raised on the system?
So all women are asked at their booking appointment about whether they have a history of FGM. And if they answer yes, then we have the conversation about the procedure being illegal in the country. So if they then go on and have a daughter, the family will be made aware at that time that this indicator has been added to their medical records. As a protective measure to help protect their child and to act as a safeguarding mechanism.
Could you talk us through just how easy and practical it is to use the FGM-IS system, including advice on how to add and remove an indicator?
So using the FGM Information Sharing system is really, really easy. You access it on your in-house computer system. You do need a smart card to do this. You get onto the NHS portal, use the child's NHS number, and the records will then come up. There's 3 screens, very easy to complete, and certainly isn't time consuming in any way.
Roughly as a benchmark, how long do you think it would take?
A couple of minutes at the most, I would say. Yeah, definitely.
Had the system been in place when you travelled abroad in the past as a young girl, do you think the right questions would have been asked?
I think hopefully the right questions would have been asked. And I can't say whether or not it would have had any bearing, but at least it would have been food for thought for my mother at that time, and probably maybe played a huge part in prevention.